If your cat has kidney disease, you're likely juggling lab results, medications, and a lot of stress. But there's more to cat care than charts and checklists. Sometimes it's the overlooked things that matter most. In this video, I'll show you what can really make a difference. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the video so I can create more content like it. Let's talk specifically about chronic kidney disease, or CKD, at home. Chronic kidney disease means the kidneys have experienced loss of function over the long term. It's different than acute kidney disease. The kidneys are still working, they're just not as efficient as they used to be. This affects the body in a variety of ways. Many CKD cats progress slowly, and with the right support, may continue to feel good, stay engaged, and maintain their routine for years. One of the major functions of the kidneys is to maintain hydration. When they're no longer working properly, dehydration becomes an issue, and one of the main drivers of many of the symptoms we see in our CKD cats. This is why it seems like your cat is drinking so well, or maybe you've noticed they're distinctly drinking more. They need to take in more water for the amount of water they are losing in their urine to maintain their body's balance. There are a number of strategies you can use to help keep your cat hydrated, and you may find that you're actually using multiple strategies or all of these strategies over time. If your cat is willing to eat it, canned food is probably the most common strategy mentioned. It's a good way to offer more moisture, as most canned foods are at least 70% water, and some cats will even eat it if you add an additional 1 to 2 tablespoons of water to the canned food. For others, we have to get a little bit more creative because they won't eat canned food. Some of them will tolerate it if you soak their dry food in some water for a period of time. Some of them like the taste enough that you can make a mash out of it and they will still eat it. Others, you just have to rely on some moisture getting on the kibble, but it still has to maintain mostly its texture and its crunch. However, you do have to keep in mind that higher moisture typically means lower calorie. So if you have a cat that's already struggling to maintain their weight, diluting down those calories with extra moisture may not be the best strategy. Another option is to provide multiple water sources. Fountains are probably the most popular one, but you need to keep in mind your cat's preferences. Some cats like water that's going down a stream. Others like water that is dripping from a faucet so it's not touching anything around it, and still other cats think bubbling is a great way to drink. Standing dishes of water can also be varied. You may want to try a mug or a big bowl or a small bowl or a tall glass. I'd love to say I understand why cats drink from the containers they do, but we don't. Each cat seems to have their individual preference, so try a variety of different containers. Take the location into account as well. Make these containers easy to get to. If your cat already doesn't feel quite right, they're not going to travel long distances to drink water. And a third strategy is to consider water temperature. Some cats prefer cooler water or cold water, while others will drink it at room temperature. You can use ice cubes in the water dishes to help keep it cooler, and sometimes just the ice cubes themselves floating in the water bowl attract your cat's attention. Flavored broths or gravy like Purina Hydrocare is also another great option for trying to encourage your cat to drink more. The thicker broths and gravy stay on your cat's tongue better, which also makes them more efficient when they're drinking. I often get asked about subcutaneous fluids, and when appropriate, they can be a great management strategy. However, this isn't a one-size-fits-all, so not all CKD cats need subcutaneous fluids, and it's very hard to explain through a video which cats are the best candidate. So I would definitely encourage you to have this conversation with your veterinarian based on their lab work, their hydration status, and your veterinarian can show you some tricks and tips on how to look for dehydration in your cat at home. But as a general rule, most cats in stage 1 and 2 CKD do not need subcutaneous fluids. Now, again, that's kind of a standard rule because there are things that can change that, as well as stage 3 and 4. A lot of cats in stage 3 and 4 can benefit from fluids, but there are some other things that you can do at home. So I know it's a popular question and I wish I had a really solid, hard, fast rule to give you, but this is more of a hands-on concept that you should be having that discussion with your veterinarian. Nutrition is another huge component of CKD management. And I've done other videos addressing the specific requirements of that food, so I'm not going to go in depth here. But if your cat will eat a food specifically formulated to make the kidney's job easier and address a lot of the secondary effects of kidney disease, that is the ideal situation. But if they won't eat it, we can't let them starve themselves either. There are some tips to keep in mind when introducing new foods to a cat. Cats develop their food preferences very early in life, and it's usually based on texture, taste, and smell. It can be really difficult to battle those preferences. They're also really good at developing food aversions, meaning they blame whatever they are eating for how crummy they feel. So it's important not to introduce a new food while your cat is feeling icky, at least if we can prevent it. In order to set everyone up for success when it comes to food changes, appetite stimulants can be used, as well as changing slowly by mixing the two foods together over time. Oftentimes we only focus on using appetite stimulants when cats aren't eating, but they can be really helpful for creating that rock solid appetite when we want to switch a cat from one food to another. So keep that in the back of your mind. Yes, appetite stimulants are good for cats that aren't eating, but they are also very, very helpful in the short term to create that hunger so your cat wants to eat the food we are offering them. If all options have been exhausted, we may simply need to wave that white flag and surrender. Cats can't go more than 2 to 3 days without adequate nutrition before it starts affecting their body systems. Always remember, fed is best. Sometimes we have to settle for something that's just a little bit better for the kidneys rather than the ideal gold standard end goal food. We don't want to create more negative effects with the food battle, and cats that aren't maintaining their weight or actively losing weight automatically have a poorer prognosis. Weight loss in cats has been correlated with a negative prognosis. In other words, unintentional weight loss can cause other diseases to progress faster. Cats must maintain a healthy weight if we're going to go to battle with CKD. With all this talk about urinating more and drinking more and eating, let's focus on litter box tips. A CKD cat will urinate more, often a lot more, making litter box hygiene a priority. This means you're going to go through more cat litter, and it means there is a higher risk for urinary accidents. Cats consistently prefer clay, non-scented, clumping litter in studies. It's soft on their paws, it's easier to dig in, and it's typically pretty easy to clean up. Keeping the litter box clean by scooping it twice a day, ensuring it's easy for them to get to, and ensuring it's easy for them to get in can set them up for success. Potty pads may also become your best friend. As cats get older, sometimes it's harder for them to navigate the litter box, and sometimes they'll urinate over the edges. You can create a perimeter around the litter box with potty pads that makes it that much easier for you to clean up. Simply pick a wet potty pad up and throw it away. Our senior cats are also prone to arthritis. This can make walking in litter more difficult. So some cats will go to the extent of putting a potty pad in a litter box so that they have a hard surface they can walk into. They're familiar with the litter box, so they'll go in there, but they'll go on the potty pad, which makes it easy for you, again, to clean up. You may even want to place a potty pad under their normal bedding so that if they have accidents while they're sleeping or they simply can't get to the litter box fast enough, again, it's easy to clean up. Details to keep in mind are making the litter box easy to get to, placing it in a quiet area, keeping it clean, like super clean, and watching for signs of arthritis that can make litter box use difficult. Think about how it feels for us to walk on pavement versus walking in the sand on the beach. Same concept applies to our cats. It's a lot more difficult for them to walk in a litter box than it is to walk throughout other areas of your house. Cats with CKD are also prone to urinary tract infections. Now, because their urine is so dilute and they're already urinating a ton, we don't always see the subtle signs of an infection like we would see with the normal cat. The drinking more, the urinating more, possibly blood in the urine. But there is a super cool product made by Royal Canin called Blue Care that are little tablets designed to be sprinkled through the litter box that will pick up microscopic blood. It's a really easy way to be proactive about urinary health. Don't forget to monitor the litter box for fecal production as well. Cats should be going at least once per day, and they shouldn't be going little hard rabbit pellets. Normal poop in a cat should look like a log, and it should be soft. Dehydration and CKD often set cats up for constipation, and constipation is definitely not going to help your cat's appetite any, not to mention in and of itself is painful. So make sure your cat is going often and enough, and that it doesn't look like it would be a painful bowel movement. Okay, let's move on to a little bit more of a medical concept, and that's blood pressure. CKD can cause high blood pressure. High blood pressure can also cause CKD. Unfortunately, it's a silent problem. So unless we're looking for it, we usually don't find it until that blood pressure is really high. And really high blood pressure can damage the kidneys, it can cause blindness, it can damage the heart, and it can cause neurologic problems. So it's not uncommon to see a cat go suddenly blind, to start becoming more vocal, or just to start acting really weird. It can also cause protein loss into the urine, and that protein loss can cause other problems, including further damage to the kidneys and weight loss. High blood pressure in humans causes migraines, so we know it's an uncomfortable situation. Our cats can't verbally tell us these things. We need to be on the lookout. Have your cat's blood pressure screened regularly, but also have it on your radar if your cat starts behaving oddly. If you have a cat that's less than pleased to travel to the veterinary clinic, consider getting a veterinarian that comes to your home or learning how to measure blood pressure yourself with your veterinarian's help. Screening a urine protein to creatinine ratio is another way to monitor for issues. Probably tied with dehydration for the most common complication of CKD is nausea. Normal kidneys help remove toxins from the body. When the kidneys aren't working, these toxins build up. Cats' carnivore lifestyle makes them particularly prone to these toxins. Subtle signs of nausea include walking away from food, lip licking, or eating a few bites of food and walking away. We have multiple medications to address nausea, and they should absolutely be used when needed. But an additional management strategy is to bind these toxins so that the kidney doesn't have to process them. Because cats require animal-based protein for their nutrition, that's what makes them obligate carnivores, they tend to develop higher levels of things called uremic toxins. Products like Porous One are available to bind these toxins in the gut so that they don't have to be run through the kidney. It helps to manage toxin buildup related nausea, and it's a proactive management strategy rather than a reactive management strategy. Unfortunately, it won't necessarily change any of the results on your cat's blood work, but it should make them feel better, and that is what we are looking for. The final tip I'll give you in this video is to focus on your cat's quality of life. While CKD isn't known to be a painful disease, many of our senior cats that develop CKD go on to develop arthritis, and this is painful. Addressing arthritis pain will help your cat feel more comfortable, move more normally, and they're more likely to eat and drink normally. Now, there are many strategies that we have for our CKD cats: food, medications, supplements, sub-Q fluids, and more. But if your cat is miserable day in and day out, you may want to consider whether doing all of the things is in their best interest. Are we helping you, or are we helping them? Some cats simply don't do well with help. I know some people like that. Some cats will let us do all of the things. I know firsthand how hard it is to do nothing. But at the end of the day, we need to remember that at least for now, CKD is a terminal illness. All of our bodies eventually fail. So celebrate the wins: good hydration, consistent eating, stable weight, and a cat that wants to engage with you. When that begins to change, it's important to look at what we're expecting of our CKD cats and their bodies. Managing CKD can feel very overwhelming at first, but you're not alone. With the right tools, many cats experience long, meaningful time with stable health and a good quality of life. If you want to make sure you're doing all of the right things, there's a link below this video for my free handout, 5 mistakes to avoid when caring for a cat with kidney disease. Click the link to sign up, and thanks for joining me.